Hi, my name is Dr. Kunson. Welcome to the operating channel. Today we're going to take a look at some mathematical operations that you will need to perform to properly do your work with your patients in math. Take a look at my patient list that I have for today. I have 3 patients. They're looking pretty healthy. Nurses checked them out. And we actually right now have 1 patient on the operating table. So let's proceed to our surgical room. Nurse, we need some lights, please. Thank you. Now, as you can see, we have our operating table set here. I need to get my surgical gloves on. This may take a second. Now, as you note, we do have this patient sitting here on the table. 16 divided by the quantity 2 plus 6 times 10. I've had my intern work on this patient already a little bit today, and I'm going to do a little follow-through to make sure that our patient is doing okay. A little follow-up. Let me secure our patient again. Clamp. Thank you. Notice we do have a little bleeding here, as you notice the red coloring. We have a few items for surgical procedures, a little rinse if necessary, or else if I get thirsty. And just a little bit of help. Notice I hope I do not get any viruses with this glove. I think we're safe. I do have my warning system here of code blue. So let's proceed and take a look to see how our operation went with this patient. It looks like my intern did a nice job of doing the things inside the body of the problem first, which was inside the parentheses, and replace this with an 8. And that's a great surgical procedure because it says that you should do parentheses first according to the old traditional doctoral thesis that said use PEMDAS. Now let's move on to our problem. Uh-oh. Looks like we might have, code blue, code blue, code blue. Let me get this out. No need to panic here though, because we are very prepared. As we notice, we have our instrument here for corrections. According to PEMDAS, we should move from left to right in our procedure. Now this person actually tried to do a shortcut method and multiply before dividing. This could cause major problems, but luckily I was here to make corrections. So the first thing we should do is divide 16 and 8. Sutures. I need sutures after this. That's a precision cut. I think that'll work and make this person feel much better. 10 there. Oh, and this is no longer division because we already divided. That's a times. Very good. Do we have a towel here? I think I'm starting to sweat. I'll make it. This needs a little bit of laser surgery now. As we continue, looks like we're on the spot there. Okay, 2 times 10. Let's burn this one off, please. Good. And a 20. And no need for this excess waste. We'll need a little rinse on that, nurse, after we're done. Now, you can see what happens when we do not follow correct surgical procedures. Oh, please do not look into the laser. And as we move on to the future, we need to know that we have to use our operating procedures properly in all that we do. Otherwise, we may have a patient that will end up not being a patient, but a cadaver. So thanks for joining us on the